All right. You're good.
All right, depending on what you read, this is either a special committee meeting of government ops or regular committee meeting of government operations. Monday, May 19th at 5:40, and councilors on the committee, Councilor Dean, Councilor Beck, and Councilor Trumbull. We also have Councilor Fornia, Councilor Pelletier, Councilor Fish, and Councilor Leonard, and Assistant City Manager Courtney.
O'Donnell.
And the Alzheimer's setting in. So the first item on the agenda is a ordinance amendment.
Yes, I actually thought that there would be representatives here from the Advisory Committee on Racial Equity, Inclusion, and Human Rights. And a part of me actually wonders if they're out in the hallway. No? Oh, okay. On this referral had referral, and this was first reading and referral to GovOps. The advisory committee met multiple times and kind of reviewed potential changes to the ordinance with the goal to create a cause for removal, as this committee in particular has struggled with membership. And so their proposed language, which is outlined in the packet, will help address that and also clean up some of the other language within the ordinance specific to that committee as well. And so there was a lot of conversation about what the attendance should look like, with the idea that this may be mirrored for other boards and committees. And so we know that because these are appointed members, best practice is or I'm told these members would have due process rights, which is why there is a procedure included in here that was reviewed by our legal office around what notice and hearing would look like for individuals that are in violation of this new ordinance if it's approved. And the issue has been in the past, most of the time, if individuals aren't able to make a meeting or if they realize the commitment's too much, oftentimes they'll just let us know and remove themselves. But what we've seen more recently is, I think, kind of folks think if they don't show up enough that it's kind of de facto quitting, but they're still technically on the committee and there's no current mechanism to remove them, even though they may not have attended like the last 8 or 10, for example. And they serve 3-year terms, which is pretty lengthy, and it's hindered this committee's ability specifically to conduct business because they often have lacked a quorum in order to make those votes and decisions that are recommended to council. Thankfully, they were able to earlier this month get a quorum. They finalized these and did make a motion to recommend to council for full approval. So happy to answer any questions.
I've got a couple.
Yeah.
So is this something that was brought forward by the committee, or were they asked to look at this, or how did we get to this point?
Yeah. So my understanding is that the committee was frustrated by the lack of attendance by members, and so they had asked staff to, like, what are our options? And so we worked together to craft this because again, our legal office was like, well, they need due process, so you can't just put like language in there that says you, for example, as the council, will remove somebody without having a formal process that gives them the opportunity to speak their case, if they will.
Yeah, and I noticed in the summary it mentions that this might be something that could be applicable to other boards in the future.
Yes.
I mean, my initial reaction was, why are we doing it just for this board? Why wouldn't we do it for all the boards? And the other thing I thought was odd, I mean, this board, we're gonna have a council representative on, which we don't have on other boards.
Mhm.
Did they ask for a council representative?
They did, yes. They
What's
thought
the
that.
reason for that?
Yeah, again, this is my own understanding, is that they really feel like that's important to make sure that there is a connection between what their committee is doing and council. And I know that there's been interest in the past by counselors, and in fact, I think several of our current counselors have been on that committee in the past. And so I think they see the value of a council liaison on the committee specifically. But also to answer your other questions, I think the idea is that this is a starting point because there was no, within the ordinance, how boards, committees and commissions is laid out. There's specific sections for each of them, but no kind of overarching section that guides all of them. And so this was meant to be a starting point to see if there was an appetite to include this sort of process. And if it worked well, then we could work through all the other boards and committees to make sure that they were aware of it. And before it went and affected all of them.
Other questions on this, Council Beck?
So if this works well, each of the different committees will also get a chance to kind of weigh in on their portion of the ordinance to see if maybe they want to take some of these on, is what it sounds like.
Yeah, I think so. I mean, I think ideally what will happen is eventually that section would be pulled out of this specific committee's section of the ordinance and a more generalized section added that would apply to all of them. And I personally felt like it was important for the other committees and boards to be aware of it, to provide their opinion if they felt strongly about what that should look like. So again, yeah, this is just meant to be a starting point to address an issue that has occurred frequently on one committee, but may have broader application.
Anything else or a motion, Council Dean?
Well, I'm in favor of the changes. I know there's been some controversy regarding the lack of a quorum. And I think by doing this, it would only increase membership one way or the other.
I think it also will open an opportunity for other folks that are very interested in attending. Because those individuals that, have just found themselves unable to attend consistently, to have a mechanism to remove them and replace them with folks that are really interested in attending and participating will be very valuable.
Okay. Is there a motion to recommend this to the council?
I'll make a motion to recommend this to council for first reading.
Good. Second.
Seconded, without any objection, this will move on to the council.
Great.
Second item is resolve for live fire service training facilities grant.
Yes, I'm going to welcome to the table Fire Chief Lowe or Deputy Fire Chief Pelletier. This is, you guys have previously approved applying for this grant, and now we have been awarded it. Deputy, would you like to give a brief overview?
Nope, as you know, we applied to this, our current facility is over 38 years old, it lacks some of the current safety standards that are required out there. And this falls in line with the Fire Protections Commission goal to have a facility within an hour's drive of other departments to use as well. So this will greatly improve our ability to train firefighters, not only for us, but for those in the area.
Any questions? Council Lemon?
I just want to state that having looked at the facility that you guys are looking to implement, it's a really impressive training facility. Just being able to have live fires like right on site and for other departments to look at. This was really just going to increase the safety of all municipalities in the area. I mean, if I were on the committee, I would absolutely just vote in favor of this. It's just a really awesome project to put forward. And I know you guys you've had an old facility for a while now, and it's time to get an update. So thank you for bringing this forward.
Any other questions? There's a motion on this item.
Yep, I'd move passage.
Second.
Seconded, without any objection, this has approval. Thank you.
One more thing,
Yeah.
on the 27th, we have some new firefighters who are learning the job. We're going to be doing some live burns at our current facility. So if you guys want to come out and take a look at that, that'll be 9 o'clock in the morning on the 27th.
It's a Tuesday.
Mhm.
Yeah, okay, great.
Thank you.
Thanks.
Thank you.
Resolve for money for the Department of Health and Human Services for the Maine Prevention
Network, yep. I'm going to welcome to the table Public Health Director Jen Gunderman.
This is the resolve to accept the funds that we have received for many, many years from Maine DHHS. The topics cover the work that we do around substance use disorder, tobacco, and healthy eating and active living.
Is this Penobscot?
Yes. We have a subcontract with Mayo,
Oh, they do it. Okay, great.
and that's a contract that we've had for a number of years.
Any questions on this item? There a motion to accept this?
I'll make a motion to accept.
Second?
The objection, this has approval. Thanks, Jay. Actually, you might be here for the next one as well.
Mhm.
So,
Yeah, the next one is the MOU with Wabanaki Public Health and Wellness to collaborate on a one-stop shop program to increase access to health-related services for people experiencing homelessness and substance use disorder. Director Gunderman.
Thank you. So the HIV outbreak has really highlighted some very particular needs in our community. What we know is that with the HIV outbreak, there's a number of people are experiencing barriers to testing, to treatment, to care, and to other supports. That's making it challenging for them to get to viral suppression and becoming undetected. As we look at other models across the country, and I think I've talked about this a little bit before, what's called the One-Stop Shop program is really an evidence-informed strategy to break down those barriers. And breaking down that barriers is literally what One-Stop Shop is. It's a place where people can go and get a number of services. And we've been in conversations for a while now with a lot of our community partners to talk about who could collaborate on this one-stop shop, what type of services could be offered without duplicating, with streamlining, and make it a place where people felt comfortable coming to receive services. So the one-stop shop model that we're looking at would be based out of the Hancock Street location that Wabanaki now has their SSP. It would be their SSP services from Bangor Public Health and Community Services. We'd be offering, in addition, HIV, hepatitis C, and other STI testing with our new handy dandy machine that gives results in an hour. Whereas it would take about 5 days to get results, which is not great when you're doing STI testing. Also to offer some vaccines, hepatitis A, hepatitis B to the adult population. We'd have a telehealth room. We would work with PCHC and others to offer a space for their street outreach. It would offer some basic needs. It would offer a space for our city outreach to meet with people who are needing support for housing, and also welcome our options team, path team, and other partners to be able to offer a number of services in this one location. To have this happen, it does require an MOU with Wabanaki Public Health and Wellness. The caveat to this is that this is contingent upon funding. We do need money to help support rent, to help support some of the supplies, to help support some of the staff time. So with the approval today, it is a contingent upon us receiving the funding to do this.
What kind of budget is that? Well,
So it varies by the year. If we were to take a look at the rent, the supplies, and the part-time staff that we would have there, I think we're looking close to about, well, that's a hard one to answer because there's some startup costs, and that will actually go into my next order.
okay,
But without the startup cost, we're maybe looking at $100,000 a year with people's time, rent, and the basic
grant
supplies.
funding, or opiate money funding, or-
We would look to request that from
Yeah.
the body
Right.
that,
Okay, is there any other questions or discussion on this thing? Motion to move forward,
I'll make a motion to move forward for consent.
second,
Second?
and no objection, this item has passage. Next item is that goes with that?
yes, it does. And so the one other thing that I wanted to mention that's pretty cool about this collaboration with Wabanaki is we've been in conversations with them about what name to actually give the one-stop shop. And so we are working with Wabanaki to request the elders of their community to help us find a name. So we're really thrilled with the strengthening relationship that we have with Wabanaki Public Health and Wellness. So the next order is for us to apply for $70,000 to Gilead that has funding around HIV prevention. Gilead is a drug manufacturer. They offer a number of different grants. We're looking to apply for this money for the startup costs for 1 year to pilot this one-stop shop program. I will say that based upon our previous experiences over the past just few months, funding is getting really competitive. with the cuts in funding happening at state and federal levels, it's a new environment for grant funding. So we would like to try to go to Gilead to ask for that startup funds. And again, this would be sort of a co-application with Wabanaki with their support.
Have we worked with them before? I've never heard, have we worked with them before?
We're just starting to work with them in terms of helping us to understand like HIV treatment and PrEP and how we can be supporting those preventive and care services. They've been a great collaborative partner for information, offering training.
So we
We've
can-
been really thrilled.
So they know who we are.
They absolutely know.
So I mean, is the cluster we've got, is it still called a cluster?
It's an outbreak.
Outbreak, the outbreak we have. Yeah, I know it's unique in Maine. Is it
Yes.
pretty unique nationally too? I mean, they're gonna say, yeah, Bangor really should be getting this, you've got a unique situation there. And we've got a pretty good shot at this.
I think based upon what we've seen nationally, I wouldn't say we were one of a kind, but I would say we're part of a very small group of municipalities that have had to deal with this situation.
Any other questions or discussion on this item? Motion to move forward
Make a motion, move forward.
I'll second.
without objection, as passage. Okay, thanks. Anything else?
Yes, I'm sorry. We had a legislative item, I think, come up last minute. Director Gunderman has that information.
So we were approached last week by Katie Rutherford at Franny Peabody, who offers a lot of HIV services down in the Portland area, including case management. And LD 1970, who actually, a number of the Bangor delegation is actually sponsoring this bill. And the purpose is to increase screening and testing for HIV. And this bill would make HIV screening and testing a part of general consent, not special consent. So right now, some HIV testing in the medical sort of delivery system, you have to get additional sort of consent to do the testing. It's a test that's very unique. You're not asked anything separate for any other testing. So this would be an opt-out. So someone would be educated in a healthcare delivery system, but they would opt out of the screening rather than just having to be part of routine screening like hepatitis C. Having it as a separate screening consent actually contributes to the stigma and not normalizing HIV testing. The evidence is pretty clear that when HIV screening just becomes part of general screening and there's an opt-out, that there's an increase in HIV testing that happens. So we would like to be able to support this LD.
I think we've got enough for the council to move, to give a thumbs up for that.
Yeah.
No,
Thank you.
nobody's opposed, there's no opposition, I will. Okay,
Thank you.
great. All set?
Thank you.
All right, this committee is